attachments of the middle turbinate. The middle turbinate has 3 attachments. The first attachment, anterior 1/3 attachment, lies in between, gets attached to the junction between the medial lamella. See, this is the crista galli, this is the cribriform plate. It has 2 lamella. This is the medial lamella, this is the lateral lamella. At the junction between the medial lamella and the lateral lamella, the middle turbinate gets attached. This is the anterior 1/3 attachment. It lies in the sagittal plane. So now the second attachment is the middle 1/3 lies in the coronal plane. This attachment, we can see that it has got attached to the lamina papyracea. So this part is known as the ground lamella or the basal lamella. This is one of the most important attachments of the middle turbinate, as it provides the maximum stability to the middle turbinate. So now there are a few variants of the ground lamella. So there might be few dehiscence in the in the ground lamella. It might be septate. Septate means one limb here and the other limb here. So it could be septate. And another important entity, which is though rare, is the missed ground lamella. What do we mean by missed ground lamella? By missed ground lamella, we mean the attachment, the second attachment won't be here. The second attachment goes backwards and lies along the posterior wall of the maxillary sinus. So this attachment is not here. It goes posteriorly to lie here. So what is the importance of forming a septa within the maxillary sinus? So anything anterior to it will act as an anterior ethmoidal cell and drain into the middle hiatus. Anything posterior to it will act as a posterior ethmoidal cell and drain into the sphenoethmoidal recess. So this is the ground lamella in the axial scan. The posterior 1/3 gets attached to the perpendicular plate of the palatine bone, and this lies in the horizontal plane. So now what are the variants? A few common variants of middle turbinate are concha bullosa, which is quite common. So what does concha bullosa mean? Pneumatization of the middle turbinate, that is air within the middle turbinate, is known as concha bullosa. So it reduces the infundibulum. So now paradoxical middle turbinate. So the curvature goes like this. This is the paradoxical middle turbinate. Interlamellar cell of Grunwald. When the vertical lamella of the middle turbinate, is pneumatized, it is known as the interlamellar cell of Grunwald. Now, what is turbinate sinus? When the middle turbinate curls upon itself to produce a concavity, it is known as turbinate sinus. Now, bulla ethmoidalis. Now, bulla ethmoidalis is the largest and the most constant anterior ethmoidal cell. Now, what are the, so this is the bulla ethmoidalis. So what are the boundaries? Laterally by the lamina papyracea, medially by the middle turbinate, anteriorly by the frontal recess, and posteriorly by the ground lamella. So poorly pneumatized or absent pneumatization of the bulla ethmoidalis is seen in only 8% of cases. Now, if there is extensive pneumatization of bulla, it may narrow the frontal recess area. Now, what is suprabullar recess and retrobullar recess? We'll see it better in the sagittal cut. So, AN denotes agar nasi. This is the frontal sinus. This area here would be the frontal recess. And considering this as the ethmoid bulla just posterior to the frontal recess, if the ethmoid bulla, normally the ethmoid bulla would get attached to the skull base. If it does not get attached to the skull base, then we have and gets attached to the lamina papyracea, we have a area above the bulla, and that is known as the suprabullar recess, and an area behind the bulla. So here, retrobullar recess. So in the coronal cut, this is the suprabullar recess. The bulla has got attached to this lamina papyracea. So this is the suprabullar recess. This is the retrobullar recess. So suprabullar recess and the retrobullar recess together form the sinus lateralis of Grunwald, and they drain into the hiatus semilunaris superioris. We have two hiatus semilunaris. One is superioris, other is inferioris. So now the uncinate process. Now what is an uncinate process? It is a sickle-shaped sickle-shaped bone which lies along the superior part of the inferior turbinate. So I will show you that the inferior attachment is always constant. It is to the inferior turbinate. The superior attachment is different, and based on that, the frontal recess drainage also changes. So in this picture, we can see this is the inferior turbinate. This is the uncinate process. The uncinate process got attached to the lamina papyracea. This dome-shaped look of the uncinate process attachment is known as inverted egg in an eggshell, and this area within the within this dome is known as the recessus terminalis. So the second attachment is it gets attached to the cribriform plate. So here we'll show how the frontal sinus drainage, frontal recess drainage also changes according to the attachment. So type 1 is when the uncinate process gets attached to the lamina papyracea. Here the uncinate process got attached to the lamina papyracea. So the frontal recess drains into the middle meatus. In type 2, it got attached to the skull base. So the frontal recess drains into the infundibulum. So what happens? Any infection from here can go to here and vice versa. Similarly, when it got attached to the middle turbinate, the frontal recess drains into the infundibulum. So type 4 is when the uncinate process lies free within the meatus, and the drainage depends on the surrounding structures variants. Now, maxillary sinus ostium. So here we can see this is the maxillary sinus, and this is the ostium or the opening of the maxillary sinus. Now, the maxillary sinus ostium lies in an oblique plane, and it is ovoid in structure and is in the shape of a tunnel. Now, in a cadaver, the maxillary sinus ostia is quite big, but it is quite narrow in a live patient. Why is it so? Because it is closed by the 4 processes: the descending process of the lacrimal bone, the uncinate process, the maxillary process of the inferior turbinate, and the perpendicular plate of the palatine bone. Now, what is the relationship of this maxillary ostia with the nasolacrimal duct? The nasolacrimal duct is 5 millimeter anterior to the maxillary sinus ostium, and laminae papyracea is around 2 millimeter above the inferior border of the lamina papyracea is around 2 millimeter above the maxillary sinus ostia. So these are few distances which we need to remember. So now a few variants. What is silent sinus syndrome? So silent sinus syndrome is here we can see this is the normal maxillary ostia, and this ostia this maxillary sinus is quite small, and we can see the lower level of the orbit. Compare the lower level of the orbit. So quite a large area has come down. So why is this so? Due to the blockage of the ostium, there is negative suction within this sinus, and this negative suction sucks in all the walls of the maxillary sinus, and there is inophthalmos drooping of the orbital, drooping of this orbit. So this is silent sinus syndrome, where the patient might not have much complaints, but the initial complaint would be one eyelid is drooping on one side, and that's it. So this is another one, this maxillary septa, inverted Gothic arch. So this is the septa, and this looks like an inverted Gothic arch. So these are a few variants.